Hi, welcome to the University of Pennsylvania's Family Medicine Residency Program. I'm Jenny Wang, and I'm the Residency Program Director here. We're located in West Philadelphia on the main campus of the University of Pennsylvania. This is Penn Family Care, which is our main residency training site. Let's go inside so you can meet some of our residents and our faculty.
Our office is on the 9th floor. Here at Penn Family Care, we serve over 25,000 patients who primarily reside in the West Philadelphia area. The majority of our patients also utilize some form of government insurance, including Medicare or Medicaid. 15% of our resident visits are children, and we do a ton of prenatal care. We then deliver those patients at the Hospital of the University of Pennsylvania, or HUB, on our very own Family Medicine OB service. Most of our patients are from West Philadelphia and self-identify as Black. We are very acutely aware of the impact that generations of structural racism have had and are continuing to have on the health of our patients. Our residency program and our anti-racism task force are committed to social justice and health equity. Our residents have contributed to eliminating the race-based EGFR in our institution and national changes such as eliminating the race-based anemia guidelines in pregnancy.
Our program offers core curriculum training in community and social medicine, as well as a dedicated community medicine track for residents interested in pursuing community-based care after graduation. Our community medicine track offers specialized electives and longitudinal rotations with our community-based partners. There, residents are able to learn more about the complex social needs of our patients. Here at Penn, our residents have the opportunity to experience care outside the walls of our clinic. Our department strongly believes in building local partnerships with different organizations to help meet the needs of West Philadelphia. We have partnerships with FQHCs, free clinics, and continue to work on expanding our mobile care delivery. With a deep commitment to social justice, we strongly believe in advocating for our patients and addressing the different social determinants of health.
Right from day one of residency, we begin developing our continuity panel of our own. Faculty and residents are paired together in pods so they can help us manage patients and results when we're out of town or on tough rotations. This is one of our 5 nursing stations. Each is color-coded for the suites in our office. Each is fully equipped for all care of all types of patients. Books for kids, injection supplies for joint care, other procedural supplies for GYN procedures, IND and skin biopsies. We also have 2 really great microscopes with teaching monitors for wet mounts and KOH preps.
The office has 2 large precepting rooms, which are great for teaching and receiving feedback. We have a large interdisciplinary team that's there to support us throughout our clinic days. We have a pharmacist team who is always ready to answer questions about new medications like insulin or GLP-1 agonists. They also offer appointments to provide counseling to our patients who require insulin titration. We have a team dedicated to wraparound care for our patients recently discharged from the hospital. This includes a nurse, a social worker, and a pharmacist to provide integrative care for our patients. Our office provides an integrative behavioral health care model to help connect our patients to psychiatrists. They also have the option to schedule an appointment with one of our 2 social workers to continue this integrative care model. To ensure our residents get in-depth, one-on-one training, we offer our specialty clinics where they work directly with a faculty member. The specialty clinics include MOUD care, LGBTQ+ care, prenatal intake, procedures, HIV and hepatitis, primary care psychiatry, transitions in care for wraparound services, and sports medicine. We also have a robust sports medicine fellowship with training from NCAA, Division I Penn Athletics, and opportunities for game coverage. Our sports medicine faculty are available for mentorship if one of us is considering fellowship in the future. In addition to our sports medicine fellowship, we also have our addiction medicine fellowship. Our residents spend a significant amount of time in outpatient MOUD clinic and graduate ready to practice this work.
We provide strong obstetrical care in an East Coast urban setting. Our residents graduate able to perform deliveries right away and don't necessarily need to do a fellowship unless they're interested in doing C-sections. We have our own independent family medicine service on the labor floor at the main hospital of the university, HUP. Our service is staffed by a family medicine intern, an upper year, and a family medicine attending like myself or a midwife. We provide integrated care for the parent and the newborn, all the way from the antepartum unit through to discharge from our postpartum service. This includes care of the newborn in the Well Baby Nursery.
Our program also provides excellent prenatal care training. With our country's increasing pregnancy-related morbidity and mortality, our residents are dedicated to reducing these health disparities and caring for our patients who would be considered high risk in many other settings. For those especially interested in obstetrics, we have an enhanced obstetrics track, including experience with antenatal ultrasounds, high-risk obstetrics, FQHC prenatal care, and a rural labor floor rotation. Our program views family planning as an essential part of being a primary care doctor. Residents are trained in IUD and contraceptive implant insertion and removal, miscarriage management, as well as options counseling and first trimester abortion. We also provide colposcopies and endometrial biopsies in our own procedure clinic.
The campus of Penn Presbyterian is the clinical center of our program. Although it is absolutely an academic center, it's smaller and retains a community hospital feel. This is where we have our family medicine inpatient service, which is staffed by family medicine residents and attendings. Most of our patients are continuity patients from Penn Family Care across the street. We're also a resource for gynecologic and pregnancy-based admissions, as well as trauma patients who are pregnant. The addiction medicine fellows and attendings run the addiction consult service here. Penn Presbyterian is an excellent hospital with some of the highest scores for quality and safety in the country. You'll find it is an excellent place to learn inpatient medicine.
While our residents are getting a phenomenal clinical education, we also strive to support resident wellness with our Director of Resident Wellness and Wellness Committee. We have changed the structure of our program to include more support for patient messages, more vacation coverage, and a dedicated annual class residency retreat, as well as an extended 3-week orientation. Each resident is also added to a buddy family at the beginning of residency. Each buddy family has a resident from each year of training and support each other through these 3 years and beyond. All of the classes are really close as well. We always have impromptu gatherings and plan monthly social events. We also have several residents who are parents and have young children, as well as residents who are single and new to Philadelphia. We also have the Underrepresented in Medicine Mentorship Program and the Alliance of Minority Physicians for additional unique support for our residents.
As a resident here, you'll feel part of a really strong community of physician advocates who are passionate about social justice in medicine and are all here because we want to provide outstanding healthcare to the residents of West Philadelphia. We hope we get to meet you in the future, and we hope that you choose our program for your residency training.